Welcome to your local Ada News. Tonight we'll be having a special health report on necrotizing fasciitis. An outbreak has occurred in the town of Ada, and all 16 members of the community have shown signs and symptoms. You may be familiar with the pathogen that causes necrotizing fasciitis because it's the same one that causes strep throat. That pathogen is Streptococcus pyogenes. It's a gram-positive bacteria that has a group A antigen on its surface, and it has a capsule. This is a type of group A streptococcal disease. Other forms, like I said, are strep throat and impetigo. Fasciitis refers to an inflammation as a result of infection underneath the soft tissue. And here is what it looks like in your body. Now we'll go to Kaylin for the weather.
Thanks, Sarah, for that interesting story. Tonight's forecast is gloomy and windy like normal in Ada tonight. It is raining respiratory droplets and bodily fluids, and they are colonizing and multiplying on our Ada townies. Beware of these bodily secretions and downpours if your immune system is compromised. Cover your cuts, blisters, or abrasions in the skin to prevent these contaminated droplets of Streptococcus pyogenes from getting on your skin and causing necrotizing fasciitis.
Thanks, Kaylin. Sounds like the weather is going to be beautiful tonight. Beside me, I have Dr. Linker. She's a specialist here on necrotizing fasciitis, has been doing a lot of studies, and has even published a book. So we have her to give the town of Ada a little overview about what the disease is. First, let me ask you a simple question. A lot of us Ada townies probably can't pronounce necrotizing fasciitis. Is there something easier that we could refer to this disease as?
Yeah, flesh-eating disease.
All right, let's stick with that from now on. So tell me about this flesh-eating disease.
Well, as you already mentioned, it is caused by Streptococcus pyogenes, which enters our body through the nasopharyngeal region through contaminated droplets and non-respiratory epithelial cells, which attaches to the fibronectin on the host cell.
Wait a minute. So it attaches, but when it attaches to our cells, doesn't our body recognize that as a foreign object and it gets rid of it?
Well, actually, the bacteria has an antiphagocytic capsule which prevents it from being engulfed by the phagocytes. It then goes on to damage our skin. The disease causes damage to the enzymes that digest your tissue, causing tissue death. This disease is non-communicable.
Wait a second. Can you please tell the audience what that means?
It means that the disease will not pass from one person to the other.
Got it. Well, thank you very much for joining us today. I know you have a lot of stuff going on. You're pretty busy. We appreciate it. We are now going to go to a word from our sponsors, and we'll be right back.
This is Sally. Sally has a red, small, painful bump on her arm and has been feverish, has chills, and nausea. Sally's bump has grown and turned purple and brown. The bump has turned black and the tissue has died off. And now her arm is amputated. Has been taking 1 gram of the beta-lactam amipenin intravenously every 6 to 8 hours. Now her symptoms are all gone and her arm is better.
Welcome back, Ada. We will now be continuing our special report on necrotizing fasciitis. For those of you who are just tuning in, or those of you who are returning, we're going to do a quick recap on what we've learned so far. Thus far in our presentation, we have gone over the etiology of the disease, the transmission, the pathogenesis, the clinical symptoms, and how you treat it. We will now be going to Meredith to see how this disease is actually diagnosed.
Thank you, Sarah, for that news introduction. I've taken fluid and blood samples from the patient and performed the ELISA test. First, I added the sample to a well. Next, I washed it to get rid of all the extra bacteria present. Then, I added a second antibody with an enzyme on one end and it attached to the antibody. I then washed the sample again and added a substrate. It turned colored, meaning that the test was positive for bacteria. If my test had turned negative, I would have performed a blood agar test to make sure it was correct. With all the recent outbreaks of necrotizing fasciitis in the town of Ada, I'm concerned about our town's safety. The best way
is to wash hands, scrape, and cut, and also look for redness and swelling. Those are the major things. What is that? Oh my gosh. And avoid diseases like that.
Ada, that is all for our program tonight. Thank you for... Hold on.
What? Really?
Ada, there's been breaking news. Dr. Rodney Anderson of Ada, Ohio, has came up with a vaccine to stop the spreading of this disease. Make sure you shake his hand and thank him for saving our community. Good night.